Hello, my name is Alex Gornitzky from the University of Michigan, and today I'll be speaking to you about Perthes disease. First, what is Perthes disease? Perthes disease is a disorder of the hip joint caused by abnormal blood flow to the top of the femur, or the ball of the hip joint's ball and socket joint. And while we know what happens, we do not know why this interruption in blood flow occurs. What we do know is that when the blood supply to the femoral head is interrupted, a portion of the bone dies. In turn, this results in structural damage to the ball that causes it to flatten out and lose its shape. Then, over time, as the blood flow is restored, the body will reform that bone in the femoral head and the flatness will level off. Putting all of that together, there are 4 stages of Perthes disease. These include the initial phase, where the blood supply is interrupted and the hip becomes painful, inflamed, and stiff. The fragmentation phase, where the body starts absorbing the dead bone in the soft ball and the head is most at risk for flattening. The reossification phase, where the bone starts to harden again and begin remodeling back into a round shape. And then finally, the healing and remodeling phase, where the bone has fully grown back and continues to remodel until the child stops growing. It is also important to know that Perthes disease is a long process, and sometimes each of these phases can last for up to a year, or maybe even longer. The goal of treatment during all phases of Perthes is to maintain the roundness of the femoral head in the socket. So, what are the long-term results? First, studies have shown that how well someone with Perthes disease does later in life is determined by how round the hip is when it is done regrowing. Therefore, the goal throughout treatment will be to limit flattening and help the hip end up round like a baseball or a basketball, and not oval like a football or flat like a hockey puck. Finally, many patients diagnosed with Perthes disease will eventually require a total hip replacement. However, our goal is to delay the need for this procedure for as long as possible. Next, who gets Perthes disease? Most of the time, Perthes disease occurs in patients 4 to 10 years old. It is more common in boys and occurs in both hips only about 10% of the time. The majority of kids with Perthes disease will first present with a limp. This may be accompanied by pain, not just in the hip, but also in the knee, groin, or thigh. There may be stiffness in the affected hip, and some kids even have a shortened limb on the affected side. In the office, your physician will examine your child's walking pattern, hip motion, and muscle strength. He or she will also look for differences between the 2 hips, as well as any discomfort. The diagnosis of Perthes disease is usually made with x-rays. X-rays help us to see the shape of the femoral head during each phase of the disease, and also help to monitor your child's response to treatment. Notably, x-rays may look worse before they look better. This is normal and represents the usual sequential healing process in Perthes disease. In some cases, your physician may also recommend an MRI to better evaluate blood flow to the femoral head. Next, how is Perthes disease treated? As discussed, how well someone does later in life is determined by how round the hip is when it is done regrowing. So, like a ball of Play-Doh, your physician's job is to help mold that soft femoral head back into a round ball by the end of the remodeling process. And we do that using 4 main principles of treatment. The first is containment. Imagine that you start with a soft blob of Play-Doh, or a soft femoral head. No matter what shape it starts as, if you then mold it deep inside the round socket, or acetabulum, when you take out that blob of Play-Doh, you will now find that you have a round ball again. The second principle is motion. Now, imagine we go back to that square blob of Play-Doh and roll it around in your hands long enough. Eventually, when you look down, you'll find that you now have a round ball of Play-Doh instead of that square one that you started with. The third principle is activity. This is the opposite of our previous example. Here, imagine that you start with a nice round ball of Play-Doh and load the top of it repeatedly, which is similar to what happens with running and jumping in impact-type activities. Eventually, you'll wind up with a square of Play-Doh instead of that ball that you started with. And the final principle is age. Young kids tend to do better than older kids, even with minimal treatment. Combining all of these principles together, your physician's exact treatment recommendations will depend upon a combination of your child's age, stage in the disease process, motion on physical examination, and the amount of his or her femoral head that is involved. Looking into specifics, the first thing your physician may recommend is activity modification, including rest and reduced activity. Most often, this means no playgrounds, sports, running, jumping, climbing, or similar type activities. Your child may need crutches, a walker, or even a wheelchair, depending upon his or her age and ability. However, this does not mean that you aren't allowed to do anything fun. Low-impact activities like swimming or biking may be okay with your physician's permission. Daily hip stretching and range of motion exercises are also very important. Physical therapy may be ordered to help keep the hip moving, and families can do these exercises at home as well as in the office with the therapist. If your child does need a procedure, one of the most common procedures your physician may recommend is a cast. This helps hold the hip in an improved position. Sometimes this procedure is also combined with either an arthrogram, where the surgeon injects dye into the hip to see how it moves, or an adductor tenotomy, where he or she makes a small percutaneous incision in the groin to cut the tight muscles that are restricting motion. Sometimes a brace will also be prescribed to help maintain motion after the cast has been removed. Unfortunately, some children do need surgery for Perthes disease. If your child does need surgery, it will be explained to you in detail, but some of the options you could expect to hear about might be a femoral osteotomy, where we cut the thigh bone to redirect the ball back into the socket of the hip joint, or a pelvic osteotomy, where we cut the pelvis to better cover the ball. Some kids may even need both of these procedures, although this is less common. Overall, it is important to remember that Perthes disease is a marathon, not a sprint. The entire process from initial disruption of the blood supply through final healing and remodeling can take up to 3 years. Your physician's recommendations will be different at each stage, but your family should be prepared for a potentially long road. In all cases, children will be monitored with repeat x-rays for several years at least. In summary, most children with Perthes disease do well and return to normal activity. However, having a ball which is not round can lead to arthritis and pain later in life. The outcome is better with younger children and in hips that keep all of their movement. Finally, in some severe cases, in which the round shape of the femoral head cannot be maintained, pain may develop as a teenager, requiring further treatment. Thank you.